Hello, everyone. This is Jane Dixon Weber. I am the Director of Education and Support Services at the National Fragile X Foundation. Today's speaker is Marcia Braden. She will be discussing information on moving from pediatrics to adult services. Marcia Braden is a licensed psychologist with a specialty in children and adolescents. She's a former teacher and has taught general and special education. She consults with local school districts and trains staff in behavioral methodology and educational strategy. She's written and published numerous articles related to education and behavior management strategies, techniques, and intervention. She's a contributing author to the book Fragile X Syndrome, Diagnosis, Treatment, and Research, compiled and edited by Rhonda and Paul Hagerman. Children with Fragile X Syndrome, A Parent's Guide, edited by Jane Dixon Weber. She authored the book Fragile, Handle with Care, More About Fragile X Syndrome, Adolescents and Adults. She's a member of the Scientific and Clinical Advisory Committee at the National Fragile X Foundation. She frequently consults with parents, therapists, educators, and medical staff about effective treatments. Respected for her work internationally, Dr. Braden has presented at numerous conferences and workshops about Fragile X syndrome, autism, and other related disorders throughout the United States and around the world. Welcome, Marcia Braden.
Thank you, Jane. I'm happy to be here with all of you, and hopefully today I will be able to share some of my personal experiences and also ideas that have been generated through the years with my colleagues and in research articles. The need for this webinar really evolved from the fact that children identified years ago are now aging out of pediatric care. And because best practice is to provide a continuum of services through the lifespan, we thought that this would be a very helpful way to help and support professionals. Often parents find themselves kind of stuck because at a certain age, a pediatrician says, you know, your child is really too old for me to continue to see him or her, and I'm no longer able to be the physician that you would normally be coming to. And sometimes this happens in our clinics. And we really want to ensure continuity of care, consistency, so that not just one provider is left with the job of finding someone else for this adult care, that rather we have it set up in a way that makes sense and is easy for parents to access. In that process, however, there are some things that have to be considered, and hopefully today I'm able to share that with you. We know that some physicians sort of are uncomfortable seeing adult patients, especially when they have disabilities, and even though they're wrapped up in an adult body, they may have some cognitive delays or other issues that cause them to sort of behave in a way that's very childlike. And that kind of makes things uncomfortable for physicians who are used to seeing people that are older and have a different status. So again, we're hoping that this will be helpful. We'll give you some ideas of ways that you can support these individuals and have a successful transition. When we look at moving from pediatrics to adult care, we really go back to a lot of what we know about transitions in general. So these people that you will be seeing certainly have made it through transitions from an elementary school, for example, to a middle school, to a high school, to the world of work, to in some cases, to college. And so we're pulling from that information and some of the history and experience that we have to help support this sort of a transition. One of the things I think that is paramount is that familiarity breeds content, not contempt. It's compliance and lowers anxiety, because we know that when they're familiar with the people that they're around and the environment, things are much easier for them. We know from visiting with adults with Fragile X females and males, that a lot of the triggers for anxiety are things like unexpected changes, being rushed, new routines, noises, and having to hear, things happening in the environment that may be very difficult to understand, and to see the emotional component of that, making mistakes and navigating and finding new places. So pulling from that, there are some bullet points here that I think that might be helpful when we're looking at this transition. For example, there will be a change in location, and the environment will be very different. We know that pediatrics oftentimes provide lots of things for kids to do in waiting rooms. We know that there are toys often. There's a lot of magazines and things that are puzzles that may be interesting. And when we go into an adult care facility or some sort of waiting room or examining room, things are very different for these individuals. So we're trying to help bridge that gap, so that if the waiting room is very crowded and very noisy, we could predict that that would be very difficult for the individual as an adult. And also just how the examining room is set up, and whether or not it's something that's very stark and makes the person feel very fearful, because it's the unknown that really does trigger some of these anxious behaviors that are often very difficult once they spiral. Change in staff. We know that, of course, there's going to be a change in staff, and the physician will be a different person, and that's very overwhelming, especially if this person has been used to going to the same pediatrician for years, or in a clinic and seeing the same staff. And so again, that has been the comfort zone for them. That has been what they can go to and sort of be safe and feel free to calm themselves down, because these people almost anticipate what bothers them or what might set them off. Also, the change in the routine. These guys pick up on this right away, and even though we may not even realize that they understand the routine and the sequence of the routine, they can really be thrown off by, what do you do first? Well, you go in, you check in, and then they take my blood pressure. But in another office, they may weigh you first and then take your blood pressure. And even though that sounds maybe sort of silly and maybe kind of trite, these are the things that start to mount then in terms of anxiety-provoking experiences for these individuals. So we recommend that we work with some visuals, as you can see at the bottom of the slide, where this person would know coming in what the sequence of events would be prior to going into the examining room and seeing the physician. If we look at some strategies, we kind of know what sets this up, but if we look at strategies that have been proven to be successful with this population, we really have to understand how you build familiarity, because that is really the balance for them. That is what calms them. And so, if at all possible, it's good to have a staff member from maybe the pediatric clinic, or if you happen to be in the same building, that would be a real bonus. That person could in fact transition with the adult for the first appointment. Just go in and check in and introduce him or her, so that that familiar sort of transitional person was available to kind of calm the nerves and hopefully help with a successful transition. We often use pictures or social stories of the new staff, and this does require some front loading, but we feel that it's well worth the time and effort, because in the long run, then that transition will be easy on the person with Fragile X, and knowing that oftentimes it's just one difficult situation that can set the stage for subsequent problems. And so to me, it's worth building that in and having that front loading and making sure we do that with as much thought as possible, so that the remaining times that this person would be seeing a physician at this location would be more successful. So the pictures of the staff, the pictures of the physician, a social story about when we go to see Dr. Rook, we're going to do X, Y, and Z. And when we check in, we will then give our name and sit down. And this will be in a story form with pictures. And it would be great if you could include the picture of the waiting room and the physician and just sort of a little tour there in a social story. Before the transition, practice entering the new office. Nothing wrong with that. Just going in. A lot of times they will want to bring something with them, and that could possibly be a transitional object. It could be flowers. It could be baked goods. It could be something that they could deliver. It could be a file with maybe an intake form in it, something that makes them really understand that this is their job, and that would be a nice transition. Often they will bring something to calm them, so it would be something that they would keep on their person. Heard a story the other day about one of my guys that's actually 70 with a full mutation, who went into a physician's office, and he loves to wear his headsets and he loves to have his radio playing, and they told him he had to give that up. He had to take that off in order for him to go into the examining room. And that then, of course, you can imagine, triggered an episode. And again, trying to convince him to go back to that physician was pretty impossible. So those things are important to know ahead of time and to understand that relinquishing those transitional objects that cause them to feel comfort is really very, very important not to do. I think, too, that when we look at the pediatrician, that person has some onus as well, and that person would be better able to help with the transition because that person is familiar to the adult that's transitioning. And so maybe something like a diploma, saying, you know what, you have graduated from pediatric care and you're going to go see Dr. Rook, and I'm going to walk you over there. If it was in the same facility, that would make it easy. If not, I'm going to send him a message or her a message about you, and I will send the diploma over as well so that they know you have graduated from pediatric care. Diplomas are pretty well known with this population because they typically graduate either with a certificate or a diploma from a high school. And so this is sort of a rite of passage, sort of a way to let them know that this time frame is over and that they're transitioning to something new. Again, in terms of familiarity, we talked about this a little bit, maybe delivering the paperwork, maybe a gift or some baked goods to the office prior to the first appointment. Again, that transitional object would be more of a way to sort of give to the staff, to get the interaction introduced, to make the person with Fragile X feel less anxious in that new environment. And this would all be prior to the first appointment. Use interest. I think it's really important to build that relationship around interest. We know that these individuals sort of relax when we can talk more about their interests. We actually have an interest inventory that could be sent out. A lot of people use these, even when someone comes to see me in my practice, for example. I like to know what they're interested in, and then I make an effort to have those things available before the first session so that that is kind of an icebreaker for us. Remember that indirect interaction is always the best way to go, especially when someone is anxious. So no direct questions, no eye contact required. Not any of this, look at me, I need to see your eyes, I need to see this or that. Just simply an indirect interaction is often very helpful. And even I take a clipboard out and I kind of go through some questions and keep my eyes focused on the paperwork that I'm filling out, because I think that also helps make the patient feel as though they don't have to interact with a real direct sort of interaction. One of the things, too, is really important is to provide room in the examining room for them to move. These are guys that to sit on a table for a long amount of time, and sometimes we understand that that is something that can't be helped because an emergency may present or another patient is needing more time than expected. But if at all possible, allow for that movement. Don't keep that patient waiting a long time in the examining room or the waiting room. That's one of the things that really tends to set things off, is an automatic trigger, because waiting, we already know, is very difficult for these individuals, especially in a new environment where it's not predictable. What's happening next is not known to them, nor can the caregiver really predict because of the new environment. So if at all possible, please keep that waiting time at a minimum. And then treat the adult like an adult. These guys are really very good at picking up on how somebody feels about them and whether or not this person really accepts them. If we talk down to these individuals, even if they are very affected with Fragile X, they can pick up on that. And that may be a trigger for them to not build a good relationship with the physician. Also, the location. We talked about that earlier, about how that sets the stage as well, and it's very likely that the location will change. So I recommend that you drive by. You might show the office. You might show the new entrance to the adult, just kind of a sense of, this is where you'll be going to see Dr. Rook, and you will be doing this next week. You can keep a calendar. You can show that ahead of time if your patient is one that generally needs to have that predictability. These are things you could actually recommend to the parent to do. So drive by, show the office to them, maybe set the GPS. These guys are pretty technical, and they can kind of tell you how to do some of this. So they may want to do it as well, to set the GPS, to get to the office, to drive by. If nothing else, the parent can do that ahead of time and do a kind of a dry run by. Find any landmarks or points of interest that may be near that office, so that, again, the familiarity may be there for this individual. Parents can provide a little storyline with, this is next to that old store that we used to go to all the time, and you would buy old comic books. Something that will give them some link to the community, some link to that location. So again, that will not be brand new to this individual. If this is a clinic that individuals have to travel to, again, that presents some difficulty because it may be novel as well to the parent and caregiver. So we want to be sure that we send out as much information ahead of time for the parent, because then those pictures can be shown, maps can be shown, Google can kind of tell the individual where it is, and sometimes they're very interested in this. If you can plan an outing, sometimes that's good, and this is really helpful for those clinics that parents have to travel to. I think giving enough time to that whole process is very important. When people travel to see me, oftentimes it's a tough trip to get to Colorado, and then if I see them the very next day and they haven't had the sleep that they need, or maybe they haven't been able to acclimate to the hotel or where they're staying, it makes a difficult consult, and I always feel like I'm not getting the best. I'm not getting everything that I can out of this individual. So maybe planning enough time so that you could have lunch one day near that location and kind of figure it all out if you're traveling. If not, I'd say just do this prior to coming in for the first appointment. Make sure that you have those landmarks identified. Make sure that maybe you have an outing that's something very fun for the individual to do. And also sometimes I use it as kind of a carrot. So afterwards, they get to go to one of their favorite restaurants if everything goes well, or just to look forward to, not necessarily a contingency, but something to look forward to after the appointment. Again, the waiting room. Now, this sort of changes when we get into the adult waiting rooms, because oftentimes there will not be young children in the waiting room because obviously we have an adult practice. This is often very difficult for my adults because I see a spectrum through the entire lifespan. And so there may very well be a younger child with autism, let's say, in the waiting room, or leaving a one of my sessions, and the person with Fragile X is an adult, then has a very difficult time dealing with that person. Or if somebody comes early and they're in the waiting room while my adult is there, those things really bother them. The good news is that when we transition to the adult services, that's not as likely to occur. However, sometimes siblings come, sometimes children of other adults are there. So just be aware that loud or noisy and crowded waiting rooms are antecedents to a lot of challenging behaviors. And we do know with this population, it's the behavior that really does the communication, communicates the stress, the distress. And again, that has to be something that you have to account for. Again, the waiting time, please make it as short as possible. And maybe even have the parent or caregiver give them permission to call you before leaving, if in fact it's a local clinic, to say, what is our wait time? If somebody's traveling, this could be even more important, because given everything that goes into the travel time, we certainly don't need more time waiting. So again, kind of a predictability where, okay, well, maybe we'll grab lunch or we'll go get a snack and then we'll come and see you. Again, proximity to the younger children, we understand that that can become very anxiety-provoking and very create a lot of fear because of the unpredictability of the younger child's behavior. Sometimes we do noise canceling headsets or earbuds with music. A lot of times you might want to, as a physician or have your staff, look at preparing the caregiver and saying, you know, sometimes it's good to do this. And if your adult child wears headsets, that's perfectly fine. Might encourage that. Make sure it's packed ahead of time. A lot of them have issues with the surround sound music, so make sure that the volume is low. Anything that you add to the mix in terms of the noise level, sometimes when somebody's hyper-aroused and anxious, just might be that tipping point that would cause them distress. So again, just be aware of those factors. When you're introducing them to the new staff, it's always nice prior to ask the parents and caregivers to come in ahead of time, maybe take pictures of the staff, the physicians, maybe even come in and videotape a welcome from the staff to the person with Fragile X, the adult. And again, if this is local, it's a lot easier, but you can do this as well through a Skype call or something ahead of time, so that the individual that's traveling there will have at least seen the individual, seen the staff, seen the physician, and also with the social story, it just adds more relevance to that. So again, maybe a virtual tour of the office. Some of the websites actually include that. So when you're going online to find those people, sometimes that may be available to you. Look online and find office pictures. The paperwork can be challenging, and we know today with HIPAA and everything else that we have to fill out that there's a lot of paperwork. The best way to handle that is to send it out ahead of time, digitally, or go ahead and send it through the snail mail, so that reduces the time when you're waiting at the office and getting the paperwork ready. Limit that as much as possible. Interview parents and caregivers by phone. A lot of times we go through a lot of our intake forms and ask the questions on the phone, so that can be done ahead of time. And it's also very good for the clinician, the physician, to be able to have that ahead of time. So again, that reduces the anxiety and gives the physician a little head start on getting to know his new patient. Interest inventory, as we talked before, once that's filled out and you have that available to you, really nice to bring that forward with interest. Because if you can come to the individual with Fragile X and mention something that they're interested in, it really does break the ice. And I think that's something that is really important to do ahead of time. And then there's just a few other factors that I think are really important to take a look at. I've been told that oftentimes there aren't proper toileting facilities in adult service offices because they're not really anticipating a need for that. And again, change of clothing, having Depends available, ways to clean the individual. There will be an accident. And if that's the case, it's really important to have that available to the caregivers. There's nothing worse than starting a session and an examination when somebody has had an episode of some diarrhea or something that's caused because of the anxiety and not being able to properly clean it. And when you think about some of the clinics that these people will be coming to, the preparation, the expense, just the wear and tear on the families and the person with Fragile X, this could be a deal breaker. I mean, this could be something that could get in the way of proceeding. And having waited to get in, having waited to come, having all of the experience to get there, and then having something like this happen that could be so easily rectified would be a shame. So again, looking forward to what can I do as the physician, what can my staff do to make this easier on this person with Fragile X and their caregivers. Again, water, Gatorade, anything that's hydrating would be important because again, with the journey being long and maybe having some issues along the way, it's important to have this as well as snacks. And I do tell parents, please pack snacks because we never know what we might be able to, how long the wait is or what we might need to be doing to provide this individual with some comfort. So again, those things are really important. Sometimes in physicians' offices, there are unusual smells, there may be chemicals. This is particularly prevalent in dentist offices. And I hear this from a lot of my female patients that are adults, that just really bothers them. And so they want not to be in there any longer than they have to be because of the smell. We do know they're hypersensitive to some smells, some perfumes. So again, just making it easier. These are environmental changes that are very easy to account for. And then I think any kind of a picture album that could be available while the person is waiting in the examining room, and that can be prepared ahead of time and just to be part of what you provide your patients to look at, just as you would a magazine, to have those things available so that that person can flip through an album while they're waiting. So I want to thank you for listening to what my experiences have been and ways that I have found to make things easier for individuals with Fragile X and their families. And I look forward to getting feedback and hearing some good things. Hopefully this has been very helpful to make this transition successful. Thanks a lot.
Thank you, Dr. Braden. We appreciate all your insights today. I think that everyone will glean a lot of information from all the information that you presented today. I want everyone to know that there are additional webinars on the National Fragile X Foundation's website at fragilex.org. We hope that you'll take a look at some of those webinars. And if you have any questions, you can feel free to send me an email. And my email is Jane, it's Jayne at fragilex, which is all one word, fragilex.org, Jane at fragilex.org. I look forward to hearing from you. Marcia, do you have any parting words?
No, I don't. I think this has been a great opportunity to help with this transition. Let's hope that all of them go very well.
Great. Thank you all. Until the next time.